Welcome to this month's Minute with Victor, where Dr. Cotton answers your questions.
This month's question comes from a physician who writes, I'm a primary care physician who is 100% office-based, and I feel like my risk of being sued is fairly low. Do you have any simple strategies that can reduce it further? Yes. Send your Coumadin patients to a Coumadin clinic. Coumadin is the most litigated drug in America. It accounts for 24% of medication-related malpractice lawsuits and about 3% of all malpractice lawsuits. And there are two main reasons for that. First, managing the drug is very labor-intensive. And second, even when you do it perfectly, patients are outside the therapeutic range 30% of the time. And the incidence of serious adverse events is 1% per year. So even with ideal management, patients still have bleeds and strokes. And when they do, there's a good chance that their INR will be too high or too low, and the lawyers blame it on us, saying that we mismanaged the Coumadin. And because the drug requires so much work, they can usually find something that we failed to do. The way to avoid that is to send the patient to a Coumadin clinic, where the drug can be managed in a way that will withstand legal scrutiny. The patients will still have complications because that's the nature of the drug, but it'll be much more difficult to blame it on mismanagement. Now, if that's not an option, then think about the newer anticoagulants, apixaban, dabigatran, rivaroxaban. They aren't necessarily safer or more effective, but they require much less monitoring, and that makes them better from a legal perspective. You see, these lawsuits claim that we mismanaged the patient's anticoagulation. So we can either have the management done in a meticulous manner in a Coumadin clinic, or we can use a drug that doesn't require much management. Either way, we're potentially eliminating 24% of medication-related lawsuits. Thanks again for listening. I'd like to tell you about some additions to our website. We have 2 new educational modules that are both videos. One addresses the risk of medication-related lawsuits, and the other addresses malpractice risks in the medical office. That video is designed for clinicians as well as non-clinicians, and you can preview both videos here on our website. The new series that we added a few months ago called The Crucible has been an enormous success. I've received multiple messages asking for more installments, so I've created them for you. They're available on our website at no cost to you, and I hope you enjoy them.